Hello, and welcome to Better Health. I'm Dr. Bobby Stowe, and this show is about you, the audience, the patient. In the next 30 minutes, we will explore, answer, and hopefully intrigue you to think about alternative methods to help explain and treat medical conditions and to help you achieve and maintain health. Some of the methods that I will talk about tonight are scientific, many with peer-reviewed research and studies, but most of our topics we'll discuss will have the latest in complementary and alternative techniques, all in an effort to find the cause or the reason of an illness or a disease, and then to treat that condition with alternative methods, many of which have few, if any, side effects. But first, let's define what health is. Health is not merely the absence of disease, but rather a homeostatic balance of the systems and the processes of your body. It's this harmony of systems that allows the body to function in a healthy manner and hopefully prevent disease. Again, this show is designed for you, the audience. It is your show. What we want to do is provide you with information that you can use to be better informed about your body and the alternative treatments that are available to you besides the current medical allopathic model. So please join us as we explore and seek better health. Welcome back. Today in the news, we're going to look at fish oils and Tai Chi, both of which have been hot topics not only in alternative therapies, but also within the medical community. First, to fish oils, which are also called omegas. This nutrient has generated a significant amount of research lately because of its ability to fight inflammation, but now we're learning that it might also lower breast cancer in postmenopausal women. In another recent study, it was found that a certain fish oil called EPA improves symptoms of children with ADHD. Both of these studies have demonstrated that nutrition used properly can have a significant effect on someone's health. Next, from the University of Florida, researchers have found that those who regularly participate in an exercise program of Tai Chi had better control of their diabetes and had lower glucose levels. This was a study of type 2 diabetics and who found that those who participated in a supervised Tai Chi program for 2 days a week and then continued at home for the other 3 days for a period of 6 months significantly lowered their fasting blood glucose levels, not only improving the management of this disease, but also enhancing their overall quality of life, including their mental health, vitality, and energy. To me, this is an incredible news because over 23 million people suffer from this very difficult and destructive disease. Knowing how a simple, low-impact, and easy-to-follow exercise program can make a significant change in people's lives, all without drugs, is truly a remarkable breakthrough. We're going to take a short break, but when we return, I'm going to explain what complementary and alternative medicine, otherwise known as CAM, is really all about and how it can help you. Welcome back to Better Health. I'm Dr. Stowe. So if someone were to ask you what CAM meant, would you know what the answer would be? In medical terms, it's complementary and alternative medicine. But what exactly does that mean? CAM is a term used to identify a variety of methods used to treat a variety of conditions. CAM treatments differ from what is considered conventional or allopathic medicine because CAM treatments do not use prescription drugs or surgery as their methods to treat diseases. By definition, complementary intervention is used together with conventional treatments, like a nutritionist working with a patient who has had gastric bypass. Alternative interventions are, by definition, used instead of conventional medicine. An example of intervention might be someone seeking a chiropractic treatment as opposed to having surgery for low back pain. CAM treatments are generally lumped together because, by definition, they are not considered conventional or Western medicine. Now, there are many different types of CAM therapies, so today we're going to discuss the more popular types and what they comprise. First is homeopathic medicine. This originated in Europe and seeks to stimulate the body's own natural ability to heal itself using small doses of highly diluted substances that in larger doses would produce illness or symptoms. It is based on the idea that like cures like. This is not much different from what a typical vaccination does to inoculate someone against a particular disease, say like measles. The second CAM is naturopathic medicine. Again, coming from Europe, this seeks to support the body's ability to heal itself through the use of dietary and lifestyle changes in addition to other CAM therapies like manipulation, herbs, massage, and the like. There are many people who use these types of treatments, and in my opinion, they can be very effective if used responsibly. Our next CAM treatment is TCM, or traditional Chinese medicine. TCM was originally created in the Middle East, but about 10,000 years ago it was taken to China, where it was developed, and the concepts of disease and the disruption of flow of qi causing an imbalance in the forces of yin and yang. Using primarily acupuncture, it tries to heal and restore the balance in the flow of qi, or the body's own natural flow of energy. Our fourth CAM is Ayurveda. Coming from India, this treatment integrates the body's mind and spirit to prevent and treat diseases using herbs, massage, and yoga. I've never seen these treatments used together, but I know that individually they are very effective. The fifth CAM is what is called the mind-body medicine. These treatments use a variety of techniques designed to enhance the mind's ability to effectively and affect body functions and symptoms through meditation, prayer, mental healing, the arts, music, and even dance. Again, many of these techniques by themselves provide great benefit to the body, but I have never witnessed their use in diseases. However, I should tell you that I truly believe that the mind is the most powerful healer of any of the therapies that we possess. Next is manipulation. Dating back to the early 20s here in America, this treatment uses a controlled force to mobilize a joint and to restore normal range of motion and relieve disturbances to the nervous system, thus restoring balance to the body. This is what most people refer to as a chiropractic adjustment, and being a chiropractor, I have witnessed many of the wonderful benefits of the spinal realignment. The seventh therapy is called energy medicine, and here there are two basic types of energy medicine. One is known as biofield therapy, which are treatments to affect the energy fields of the human body. However, there's no scientific literature to support that these energy fields exist. The second one is called bioelectromagnetic therapy. This type of therapy believes that you can use a magnetic field to heal the body. Here again, there isn't a whole lot of scientific literature to support these types of treatments. And our last CAM is called integrated medicine, or IM. IM attempts to treat the whole patient using a partnership between the patient and the doctor with the goal of treating the body, the mind, and the spirit all at the same time using therapies which are supported by evidence-based research. This is a type of approach that I personally use in my own practice with my own patients, and I believe this is the best method to treat all patients. Now I'd like to make one issue very clear. Some of these therapies have little or no scientific evidence to support or substantiate their treatment claims. As modern scientists would say, there is no scientific basis on research efficacy of a claim. In other words, science hasn't yet discovered how or why something works. And in the scientific community, if you can't back up a claim with research, then your treatments are considered invalid. But I would suggest that just because we don't know how something works, it doesn't mean that it doesn't work. It simply means that we haven't figured it out yet. It kind of reminds me of Benjamin Franklin, and if any of you remember when he was asked why he failed more than 100 times before he invented the light bulb, he replied that he really hadn't failed, he simply found 100 ways that it didn't work. Another very important point to remember is that with any treatment, whether it's conventional medicine, CAM, a patient should always understand all of the potential side effects or risks that could occur with any particular type of treatment, be it nutraceutical, pharmaceutical, surgery, CAM, or even doing nothing. Now we're going to look at some interesting facts about who uses CAMs and therapies and which therapies they use. So why do people use CAM? Conventional methods typically have not been successful as a method of preventing or stalling surgery. Some believe that their religious beliefs allow them to use CAM to prevent disease as opposed to treating a disease, or to improve the quality of their current health, to have greater control over one's health. Now we're going to look at some interesting facts about CAM usage and who exactly uses CAM. In the first chart, we're looking at a 2007 graph of the ages by which people use CAM, and you can see from the graph that 18 to 45, 75 is a good number of people using that, but also I bring to your attention that 0 to 17, there's quite a bit of usage in that category also. The next graph we're going to look at shows us what kind of conditions or diseases were used, and not surprisingly, backache was the number one, and that's primarily because the vast majority of people who go to their clinician do so for back pain. The next graph looks at what types of products, and of course natural products come into play, they're number one, but then deep breathing and meditation rank right up there also. Chiropractic is number 4, but yoga is coming in very close as a high usage of these CAM therapies. And the last graph we're going to look at is the products. Echinacea is one that's used to help with the immune system and to fight bacterial and viral infections. Ginkgo's there, everybody's heard of ginkgo. And as you can see, it even goes down to soy. I'm not a fan of soy, and we'll talk about that at a different time. So now what I'd like to do is briefly discuss the differences between Western conventional medicine and CAM. I believe this comparison will provide you with an understanding of just how different these two approaches are to health. CAM versus allopathic medicine. The first is the approach. It's a mutual approach with CAM. It's personalized. There's a relationship between the patient and the doctor. It's non-invasive, typically very easy on the body. The treatment styles. This is very important to me because it's disease-focused versus patient-focused. CAM therapists are very patient-focused. We use natural supplements, herbs, massage, and the like. Potential side effects are few versus many. And then simple versus complex. Simple, easy to understand is typically the CAM approach. It is my personal opinion that neither CAM therapies nor medical providers should be standalone approaches to a patient's wellness, but rather CAM therapists and allopathic medical providers should work in conjunction with each other for the mutual welfare and benefit of the patient. There should not be a competition or control for the patient, but rather a union, a conversation, a partnership to find the best treatments and therapies available for any given patient and their condition. Now, for those considering or seeking CAM assistance, there are some things I believe you might want to consider when looking for a provider. First is training. Does the provider have sufficient training in the field in which they are practicing? The next is licensing. Is the provider certified or licensed by a local, state, or federal authority to provide the given services? Third is experience. Does the provider have sufficient experience in the treatment or procedures that he or she is practicing? Research is the next area of concern. Is there some type of evidence that the procedures or the therapies provided have assisted other patients with similar conditions? Next is insurance. If required, does the provider have malpractice or some other type of insurance coverage? And lastly, and maybe the most important, is rapport. Do you feel trust and comfortable with your provider? Is he or she focused on you during your treatment time and understanding your needs? Complementary and alternative medicine is a rapidly expanding and truly important part of many people's health care. To learn more about CAM and what it might do or mean to you, do some research on your own, or send me an email with any questions you'll have, and I'll do my best to answer them in our next show. There's one more segment to our program, and it's called Ask the Doctor. This is where you, the viewing audience, can ask me questions. Let's take one more break and we'll be right back. Welcome back. We only have time to answer 2 questions on this episode, but please keep sending in your questions to hcctv@hccs.edu, and I'll do my best to answer them as time permits. The first question asked, does prescription calcium supplements really improve the longevity of your bones? The easiest way to answer that is it could, but it may not be. Calcium is one of the ingredients that's needed in order to help the body keep their bone mass density as hard as it can, but it may be that you need other areas or other nutrients, and one of the other areas that I like to look at is the pH of your blood. We can't go into it in great detail, but calcium will help, but it by far is not the only thing that you need to look at is bone density. The next question is about avoiding or lessening the pain of arthritis. Now that's a great question because many people suffer from arthritis, and you have to remember it's an inflammation process. The question I would ask as an alternative provider is what is causing the inflammation? There are several blood tests that we can use in order to determine exactly where the arthritis is coming from and why is that inflammation there. So once we understand that, then we might be able to help you. But in the short term, heat and exercise, moving those joints, that is one of the best ways, along with heat. And of course, glucosamine, chondroitin, and another supplement called MSM are great ways to help lubricate the joints. Well, this ends our first episode of Better Health. I hope you've enjoyed this show. It is really my desire to help educate individuals about a variety of conditions and treatment options that exist outside of the modern allopathic world. I should also state that in no way am I making any type of diagnosis or for any condition. All of the comments on the show are for informational purposes only. Any condition that you might have or think you have should be discussed with a qualified healthcare professional. In our next show, we'll be discussing nutritional supplementation. Now, this is a multi-billion-dollar-a-year industry with very few, if any, standards or regulations. During that show, I will try to inform you about some of the benefits and obstacles of selecting supplements. Again, I encourage you to send any questions you might have regarding today's topic or any other health-related topic you might have. Just send me an email to hcctv@hccs.edu, and as time permits, I'll answer your questions on the air. Until our next show, take care, enjoy life, and live healthy.